Hi, Tyler. So I'd love to discuss Corey 10 and a plan for his next session. Just to recap, Corey's a 10-year-old boy who was referred to me by his mother. She was concerned about his anxiety levels and possible learning difficulties. Um, so I believe the treatment goal that should be the focus of the next session involves addressing Corey's negative self-talk with age-appropriate activities that will serve as psychoeducation for him. Um, while Corey is exhibiting some anxious symptomology, he has stated that he gets highly anxious at school when asked to complete certain activities. What seems to be, though, the overarching maladaptive thought driving these anxious behaviors are his negative self talk, really high self-criticism, and like a lack of self-acceptance. So these are really common for kids who are anxious, but with perfectionistic thinking patterns. The thing is, I truly believe I can't really make a dent in helping him with his anxiety unless I address this core belief that he has that I am a failure. Um, so research has shown that perfectionism uh, can actually, get in the way of positive treatment outcomes, like they can hinder it or delay it. So my thinking is that I must address Corey's belief about needing to get things perfect before moving on to other things. And this is why I would like to incorporate cognitive behavioral therapy, so CBT, within a positive psychological framework. So CBT has been found to be effective with children suffering from anxiety with perfectionistic tendencies. Um, following on from Corey's initial session, it became pretty evident that Corey is exhibiting anxious symptoms. They include getting anxious when asked to read out loud to the class because he fears getting things wrong. Corey also states that he gets anxious because he thinks his teacher gets frustrated when Corey needs instructions repeated. So while I do believe Corey's anxiety needs addressing, his perfectionistic thinking is really critical to address at the moment. He scored quite high on the child adolescent perfectionist scale for one. Um, in his initial session, he showed quite a few signs of struggling with like his self-oriented perfectionism. Corey stated that on more than one occasion that he felt like a failure. He also stated that he doesn't want to get things wrong and he gets really easily frustrated when things don't come easily for him. Um, he procrastinates with his homework and this stresses him out when the deadline is looming. So procrastination is certainly one of the common factors, one of the common behaviors in perfectionists. And finally, it appears that he suffers from also task paralysis. So this can be seen when his parents talk about his morning routine, like getting ready for school, like he just can't get moving. It's almost like he has no sense of time. So these are all marked behaviors of an individual suffering from anxiety with perfectionist tendencies. So more specifically, it has been found that targeting a client's positive sense of self and working to improve this first will help improve the overall treatment of perfectionistic maladaptive behaviors. So if I can start to work with him on his self-criticism, this lack of self-acceptance, and this, just wanting to make things perfect through like rapport building and age-appropriate activities, then I believe we're off to a pretty good start. A problem, though, that research has found with treating individuals with anxiety and perfectionist tendencies is that it can get in the way of progress. So this is something that could be a client factor with Corey's therapy with me. Corey may show up not wanting to participate, not out of anger or frustration, but just out of shame and fear that he's going to get things wrong within therapy. So I do need to tread quite carefully. And this is why I think coming from like a positive psychological framework, lots of rapport building, lots of compassion is going to help overcome that. As for clinical factors, clinician factors, my own daughter went to therapy for a long time, like over a year, for her high anxiety and perfectionistic thinking. I think I may need your help just a little bit more when working with Corey, just to kind of minimize the chance of any counter transference occurring between Corey and I. the last thing I want is to act unethically and lose sight of Corey, not really respecting his own journey because I'm blindsided by the experiences that I had with my own daughter. So that's where supervision, I think, really comes into play. So I'd really want to discuss my step-by-step plan with you. So I am going to anticipate that Corey may feel like a failure first off and will be very slow to warm up to me again, just like the initial session. Hopefully that's not the case, but you never know. So like I said, I would like to respond quite appropriately, just explore what he's feeling with a lot of compassion and really try to build on that therapeutic alliance with him. I would like to go on from there and ask Corey about his favorite superhero or movie character or book character. I mean, he does like to read. And I'm going to ask him to draw it up on the whiteboard if he's comfortable doing that. And this will again strengthen that therapeutic alliance between Corey and I. I would like to ask Corey to consider whether this character may feel self-doubt from time to time. And this is where we're going to start to talk about being imperfect as opposed to perfect. This is where I'm going to highlight that self-doubt is normal for everyone from time to time. And I may actually use self-disclosure here just to kind of make sure that he understands that it's normal for everybody. I'm going to ask Corey if he thinks the character believes that he needs to be perfect or they need to be perfect. So here, rather than flat out challenging Corey's belief about being perfect, I'm going to try to get him to think about someone else so that it's a little less confronting. I would like to highlight that some people have like a little voice inside their head that tells them to do things perfectly. And I'm going to ask Corey if he hears this voice sometimes. And this actually comes from a really great workbook that I have found. It's by Freeland and Toner. It's called What to Do When Mistakes Make You Quake. And it's a guide for kids to tackle imperfection. So this is where CBT is going to come in because I'm going to ask him to monitor his thoughts here. I would like to introduce a new activity here where we reference the perfectionistic voice as a character, so something outside of himself, and I would like Corey to name him. So this makes things less scary for Corey. Hopefully putting Corey outside of his thoughts again, like an observer, it's really helpful within the CBT framework. I would like to ask Corey to write like maybe one or two things that this voice says in his head that he does not like. And I'm pretty sure he's going to say things like, this voice is telling me I'm a failure. And we can talk about things like how this voice makes him feel. And those types of things come from this fantastic workbook. It's called What to Do When You Worry Too Much. It's by Huebner and Matthews, and it's a kid's guide to overcoming anxiety. And this is where we can kind of discuss how these thoughts make us feel. So trying to get Corey in touch with his feelings and how they are affected by his thoughts. I'm going to ask Corey here to really do some CBT with me and collaborate with me to transform these critical thoughts into more helpful ones. And again, that's come from this particular workbook. And this is going to hopefully really build a strong collaborative therapeutic alliance with Corey and add to his self-efficacy by getting involved. I'm going to ask Corey if there is something he can do in class this week to use these statements to help him overcome this negative ninja that comes up in his head quite a lot. And I'm going to not call it a goal. I'm not going to call it anything like that. I'm going to call it like maybe a task or a project, because research has found that these words can just create too much pressure for a child with perfectionistic thinking. So I'm hoping that I leave about 5 minutes at the end of the session. And this is where I really would like to praise him for his cooperation, for his thinking, for his creativity, and just for listening to me. Because with perfectionistic children, especially those that really see themselves as highly critical, it's really important that I really use the chance to praise his effort rather than his achievements. And there, I'm just going to let him know that I'll be discussing his therapy with his parents. And that's it. So please tell me your thoughts about my plan. Thanks, Tyler.